Have you ever wondered what the next pandemic could be? Let's start by understanding what a pandemic is. Picture a disease that doesn't just affect one community or one country, but spreads across continents, impacting millions or even billions of people. That's what we call a pandemic. Historically, pandemics have left their mark on humanity in profound ways. Take, for instance, the Spanish flu of 1918. It infected 1/3 of the world's population and caused the deaths of tens of millions of people. Or consider the Black Death, a pandemic that swept through Europe in the 14th century, wiping out an estimated 25 million people, about 1/3 of the continent's population. These are just two examples of pandemics that have shaped human history. Now let's fast forward to the 21st century. The world is grappling with the COVID-19 pandemic. It's not just a health crisis, it's a crisis that affects every aspect of our lives. From the way we work and study to how we socialize and travel, COVID-19 has changed everything. Economically, it's plunged the world into a recession, with millions losing their jobs and businesses shuttering. On a personal level, it's brought loss and grief to many homes and has taken a toll on mental health. But it's not all doom and gloom. The COVID-19 pandemic has also shown us the power of global cooperation in tackling a common enemy. It's brought to light the importance of public health systems and the essential role of healthcare workers. And it's sparked innovation in fields from vaccine development to remote working technology. So, as we've seen, pandemics can have far-reaching, devastating effects. But what could be next? What factors could lead to the next pandemic? It's a question that's been on many minds, especially in light of recent global events. There's no simple answer, but there are a few key factors that could potentially contribute to the emergence of a new pandemic. Firstly, let's consider climate change. As global temperatures rise, habitats shift and ecosystems are disrupted. This can bring humans into closer contact with animal species that they might not usually encounter, increasing the chances of zoonotic diseases, those that jump from animals to humans, to emerge. Next, there's urbanization. As cities expand, people are living in closer quarters than ever before. This high-density living can make it easier for diseases to spread quickly and widely. Additionally, the encroachment of cities into natural habitats can again increase our contact with wildlife, giving zoonotic diseases more opportunities to jump to humans. And then there's global travel. In the 21st century, it's possible to hop on a plane and be halfway around the world in a matter of hours. While this has undoubtedly brought many benefits, it also means that diseases can spread across the globe at an unprecedented speed. A virus that emerges in one city could potentially reach every continent within a day. Of course, these are not the only factors. Changes in agriculture, antimicrobial resistance, and even political instability can also play a role in the emergence of a new pandemic. It's also important to note that these factors can interact in complex ways, amplifying each other's effects. For instance, climate change could exacerbate urbanization by making certain rural areas uninhabitable, forcing people to move into cities. In conclusion, it's clear that various factors can contribute to the emergence of a new pandemic. But how can we prepare? The answer to that question will be the focus of our next segment. Stay tuned to learn about the crucial role of prevention and preparation in mitigating the impact of future pandemics. Prevention is better than cure, especially when it comes to pandemics. Now, let's delve into the realm of prevention and preparation, two key facets in the battle against pandemics. First, we need to understand why prevention is paramount. Think about it. By the time a disease becomes a pandemic, it's already spread across countries, continents, or even the entire world. That's a lot of ground to cover when it comes to treatment. But if we can prevent or at least slow the spread of a disease, we can save countless lives and resources. So, how do we do that? For individuals, it starts with simple measures like proper hygiene, washing hands regularly, avoiding close contact with sick individuals, and wearing masks during outbreaks are all small steps that can have a big impact. Vaccination is another critical tool in our pandemic prevention kit. Vaccines prepare our bodies to fight off diseases by exposing us to a safe version of a virus or bacteria. It's like a training session for our immune system, and it's one of the most effective ways to prevent the spread of disease. But it's not just about individual actions. Communities and governments play a vital role too. Communities can promote healthy behaviors, provide resources for those in need, and foster a sense of collective responsibility. Governments, on the other hand, can implement public health policies and regulations like quarantine measures during outbreaks to keep their citizens safe. They can also invest in healthcare infrastructure and research to better understand and combat diseases. And let's not forget the importance of international cooperation. Pandemics don't respect borders, so it's crucial for nations to work together, sharing information and resources to tackle these global threats. All of these measures, from washing hands to international collaboration, are pieces of the pandemic prevention puzzle. They help us prepare for the worst, so we can hope for the best. By understanding and preparing for pandemics, we can reduce their impact. But what role does technology play in this? Science and technology are key players in the fight against pandemics. They are the superheroes that don't wear capes but instead wield microscopes and algorithms. In the realm of disease prevention and management, scientific research and technological advancements hold an immense power. They provide us with the knowledge and tools to understand, anticipate, and respond to health crises. For instance, research in virology and epidemiology can help us understand how viruses spread and mutate, allowing us to predict potential pandemics and develop strategies to contain them. In recent years, we've seen some truly groundbreaking innovations in public health. Vaccine development, traditionally a process that could take up to a decade, has been accelerated dramatically. The development of the COVID-19 vaccines in under a year is a testament to this. These vaccines, built on innovative platforms like mRNA technology, are a beacon of hope and a prime example of the power of science. But it's not just about vaccines. Technology also plays a key role in disease tracking and surveillance. Digital tools, such as artificial intelligence and big data analytics, are being used to monitor disease outbreaks in real time, predict their spread, and inform public health interventions. This is crucial in our globalized world, where a disease can travel from one continent to another in a matter of hours. Technology is also helping to democratize access to health information. Through smartphone apps and online platforms, people can receive timely updates about disease outbreaks, learn about prevention measures, and even track their own health. But while these advancements are impressive, they are not a silver bullet. They must be coupled with robust public health systems, equitable access to healthcare, and a commitment to health education. After all, the best tool is only as good as the hands that wield it. Science and technology have the potential to drastically change how we handle pandemics, but it's up to us to use them effectively. We've covered a lot of ground today, so let's recap. We began by defining pandemics, using historical examples for context. These global disease outbreaks, such as the Spanish flu and more recently COVID-19, have profound implications for societies worldwide. We then delved into the concept of the next likely pandemic, highlighting the various factors that could lead to such an event. Environmental changes, urbanization, and global travel can all contribute to the emergence and spread of new diseases. The unknown can be daunting, but with knowledge and understanding, we can better equip ourselves for what may lie ahead. This led us to the crucial topic of prevention and preparation. We emphasize that everyone, from individuals to communities and governments, has a role to play. Simple actions like washing hands, getting vaccinated, and maintaining a healthy lifestyle can make a significant difference. On a larger scale, investing in healthcare systems, implementing effective policies, and fostering international cooperation are all essential in preparing for potential pandemics. Of course, we cannot overlook the role of science and technology. From disease surveillance and diagnostics to vaccine development and digital health innovations, these tools are at the forefront of our fight against pandemics. They help us detect, prevent, manage, and ultimately overcome these global health threats. As we conclude, it's important to remember that understanding and preparing for pandemics is not just about fearing the worst. It's about empowering ourselves with knowledge, taking proactive steps, and leveraging advancements in science and technology to safeguard our health and our future. Thank you for joining us on this journey. Remember, understanding and preparation are key in the face of a pandemic. Don't forget to subscribe, like, and share your thoughts in the comments. Until next time, stay safe and stay informed.